Hi, I'm Dr. Asaad Samra. I'm a board-certified plastic surgeon. I'm honored to have been voted Best of the Best by New Jersey Monthly for post-mastectomy reconstruction using implants, as well as facial trauma. I'm a New Jersey native, born in Perth Amboy. I did my schooling in undergraduate in Johns Hopkins University. I came back to New Jersey to do my medical school at Robert Wood Johnson, now Rutgers Medical School. And then I did my training in Houston, Texas, where I was there for 6 years at the Baylor College of Medicine in the Texas Medical Center. Upon completing my residency, I then came back and joined the family business of plastic surgery. My father is a plastic surgeon who's been in practice since the early to mid 1980s, and we do everything plastic surgery from cosmetic to reconstructive as well as hand surgery. My biggest challenge actually was, believe it or not, getting into plastic surgery. When I was in medical school, I went to, as I mentioned, Rutgers Medical School or Robert Wood Johnson Medical School, where they didn't really have a lot of people getting into plastic surgery residencies. At the time, most people went into general surgery and then transitioned into plastic surgery, but there were these integrated programs where it allowed you to go from medical school directly into a plastic surgery program. At Robert Wood, I wasn't really supported in that, as they thought that it would be difficult for me to get in. But I was dogmatic about it, as I knew plastic surgery is where I wanted to be. I did some research, and then ultimately I went across the country to Texas as well as to Pennsylvania, training with some people, and ultimately from medical school was able to get into an integrated program in plastic surgery, where I ultimately was able to graduate as a chief resident and then join the Samra plastic surgery business. I would consider my greatest achievement to have really been able to integrate myself into the breast reconstruction community. It is really rewarding to me to be able to be a part of a patient's journey when they're dealing with breast cancer as a diagnosis. The difficulty in having to lose a part of themselves can be met with and sometimes overcome by the hope that they may become better or stronger at the end of this journey. And I thankfully have the skills to be able to help them achieve those goals. Most recently, I had an opportunity to go to a conference that was held in Atlanta, otherwise known as the Atlanta Breast Symposium, where we discussed using nerve grafting techniques to bring sensation back to the mastectomy breast. Classically, when a woman has had a mastectomy, she will lose sensation of her breast. And though we've become experts at creating the form of a breast, the next frontier is creating sensation. So using nerve grafting, we are able to take natural nerves that are in the chest and connect it to the mastectomy skin, resensitizing that breast, otherwise known as resensation. A patient who comes into our practice that will ultimately meet me can expect to get the utmost care and respect. I'm a busy doctor and sometimes my schedule runs behind schedule. That being said, I'll share with you that when I'm with my patient, they have my undivided attention. They will know that I will listen to them, I will care about them, and I will do the best I can to give them the outcomes they deserve. I find that my breast reconstructive patients are very grateful to have been able to get a piece back that they thought they were going to lose for forever. And that connection that I make with patients is something that I cherish, as my patients do feel part of my family rather than ultimately just a patient. I see my patients typically on a yearly basis, and we find ourselves spending more time talking about their social life rather than just their clinical life. And that change that I've made in their life is really meaningful.